next edition of our video blogs. Back to the basics, movement. We just did a why. Today, back to the basics, movement, motivation. A lot of words. Maybe we need to cut down on the words. How about we just stick to the motivation? In the last video presentation about exercise and movement, I went through and covered the ABCs: heart health, cardiovascular health, mood, anxiety, depression, a lot of ABCs. Today, I want to give you, and I'm going to, I hate to say it, but read a couple snippets of articles to you that will give you some rationale as to why. Everything from blood pressure to you name it. I just pulled a quick smattering that I think are very, very critical. But the motivation part, I believe, is really the key. As I sat and put these together, I've been thinking about this quite a bit. Why is it that everybody just doesn't do it? Why do we just not do what we need to do? Things come to mind: lack of diligence, stuck to our past. We allow things that have happened in our past to dictate our future. Oh, well, I've never been athletic. I've never been one to exercise. I'm overweight. I'm out of shape. I did that 12 years ago, 15 years ago. I did it when I was a kid. Now I'm not a kid. I have physical problems, knees or ankles or issues or arthritis. And I know some of you have physical limitations, but many of you viewing this do not. And I know you do not. We're going to do another one. There'll be another sequel to this on the how-tos, some of the ABCs. We're not going to physically maybe demonstrate. We're going to talk about some things that you should do if you have limitations and the types of exercise that are important. But today, I need to talk to you about being motivated. Now, I'm going to adapt a few thoughts from Mike Murdoch because I believe that they're very, very good. And I'm going to go through and I'm going to read you a few of these as I read some of the studies. Number one, be willing to do something that you've never done before to create your future. Many of you have to simply realize the status quo is not working. You come home after work, you eat, you plop down on the couch. That's a problem. Maybe many of you are working, you come home, you have many other things to do at home, you don't have time. At some point, you can't tell me you don't have 20 minutes, 30 minutes. If I can find the time, I know you can find the time. Number two, be willing to build your future, not around your past. Don't build your future based on your past. And I've talked a lot about this because it sounds a little bit redundant, but many folks have a framework and a mindset. I want to talk to you about changing your mindset and changing your heart attitude. If you're stuck in those thoughts, you're overweight, you've been unsuccessful in the past, I've tried this before, I couldn't keep up with it, I got away from doing it, you are letting your past frame your future. At some point in time, you need to make your face like a flint and not look back. And I don't care if it's 15 minutes or 20 minutes of physical activity, then that's what you need to do. We'll talk more about those. Some of the reasons that should motivate you. Older individuals that exercise, diet but don't exercise, lose muscle mass. A group of sedentary and overweight elderly individuals went on a 4-month exercise program, not only become more fit, but they found that they burned off additional fat compared to older sedentary people who were placed on a diet but did not exercise. This was done at the University of Pittsburgh, locally here in Pittsburgh. It appeared in with the American Physiological Society. I want you to get that. Those that were sedentary, overweight, went on a 4-month exercise and diet plan. They did much better, weight loss, everything, versus the group that just went on a diet. There must be a combination if you want to improve. Number two, high-intensity exercise. I'm not saying this is for everybody, but this is just to bear some points. High-intensity exercise works best to reduce anxiety. University of Missouri. Cardiovascular disease, the leading cause of death in America, a major factor in heart disease. And I've talked about this for years. The stress hormones. All the medical community wants to talk about is cholesterol. There's so much more to it. Stress can make your heart fail. It creates inflammation, damages the lining of the arterioles, your blood vessels. Now oxidized cholesterol comes and adheres to that damaged portion of the blood vessel. And a lot of it has to do with the release of stress hormones through and because resultant of stress. So what they're saying is simply higher intensity exercise reduces stress, reduces anxiety, which may lead to a reduction in heart disease. Moreover, the researchers found that high intensity exercise especially benefits women. Exercise, reducing stress hormones, reducing the risk for cardiovascular disease. And don't tell me, you knew of a guy that was 48 years old and used to run at the park 4 times a week and keeled over of a heart attack. I know those are always exceptions, and there are exceptions to the rule. Bad things still do happen to good people. We understand that. We live in a broken and a fallen world, and there are exceptions. But you must understand that if you're still choosing and allowing your past to frame your future, you're going to be stuck in that thinking, and the odds are against you. The percentages are certainly not with you. Let's move on. The adage for years was that folks that had a heart attack, an MI, that they needed to just rest. Well, more recent literature says that you need to be more active. University of Alberta at Edmonton, Mark Hakowski, Rehabilitation Institute researcher, says we have found that exercise has a favorable effect on heart function. It also is important to dispel the idea that what it needs, the heart that is rest. Let me read that to you again. It's important to dispel the idea that what the heart needs is rest. He's saying that when you work the heart, literally, I mentioned in a previous video blog that there's a release of endorphins with exercise. And those endorphins help to remodel and repair the heart. That's exactly what he's talking about. In fact, the study shows the heart will become better with exercise sooner and with continued exercise over a longer period of time. If you've had a heart attack and you've had heart disease, and I want you to talk to your cardiologist, etc. I don't want you to do something where you have other cardiac issues. But if you've had a heart attack, once you're able to be up and about, we need to get you moving. They say, what's that? I've never had a heart attack. I'm 38 years old. No, get the big picture. Don't get stuck on some of the silliness. Get the big picture thinking that this is telling you that even when parts of the body, so important, such an important organ as your heart, has been damaged, it remodels, it repairs when people start exercising more quickly and over a sustained period of time. What does that tell you about the rest of the body? All right. Schizophrenia. Regular exercise guidelines still apply. Exercise can play an important role. I combine 2 words, regular and exercise, rexercise. Regular exercise can play an important role in improving the physical and mental well-being of individuals with schizophrenia, according to a new published trial coming out of the Cochrane Library where they reviewed multiple articles. Researchers found that exercise programs improve the mental state measures including anxiety, depression, when compared to standard care, which would be talk therapy and pharmacology, pharmaceuticals for schizophrenia. Are you following me? You could have a patient that has something as severe as schizophrenia, and when you combine it with talk and counseling and pharmacology and pharmaceuticals, you throw in exercise, and I would add, throw in dietary changes and mega doses of quality omega-3 800s, and possibly look at gluten intolerance in schizophrenics, you can see a huge difference. But today we're talking about exercise and movement. It is critical. Another one. This article appeared at a meeting of the Associated Professional Sleep Studies. This was back in 2008, and it simply says that sessions of moderate aerobic exercise, but not necessarily heavy, can reduce anxiety states, improve sleep quality in insomnia patients. How many folks are using fluorazepams, Ambiens, sedative hypnotics to reduce anxiety and issues associated with sleep and insomnia? Movement and exercise greatly improves it. Let me give you the details. Reductions were seen in sleep onset latency That means the time that it takes to fall asleep, the latency period, was shortened by 54%. So if it took you an hour, you're down to 30 minutes. The wake time when folks were awakened was shortened by 36%. So if once you awaken and you were awake for an hour, it's reduced by approximately 40 minutes, 35 to 40 minutes, as opposed to an hour. Moderate exercise improves insomnia. Let's keep going. Runner's high strengthens the heart. I quoted this in the last video blog. Endorphins and other morphine-like substances known as opioids, which are released during exercise, they don't just make you feel good, they also may protect you from heart attacks, according to researchers at the University of Iowa. Runner's highs, natural opioids that are released, may be responsible for some of the cardiovascular benefits that we've seen. This is the first evidence that links natural opioids during exercise as being cardioprotective. Exercise improving or just as good as a drug known as topiramate or Topamax to prevent migraines, University of Gothenburg in Sweden. Folks, it goes on. I have more. Regular exercise underutilized for chronic back and neck pain. The list goes on. Burning fat and carbohydrates during exercise. When you move, you burn carbohydrates, you burn fat. I have oodles. This was also done at Copenhagen, the Muscle Research Institute. I have oodles of research and information. I think you get the picture. The first video on movement was the whys. Why do you need to? This one gets a little bit more into the motivational aspects. Here's the science related to your health. And now I'm just going to read you a couple of things. And this is not mind over matter. What I want to do is motivate you in your inner man, in your spirit, in your heart. Because many of you are on a road to destruction, a path of destruction. You're cutting your lives short. You have no idea the consequences of diabetes and cardiovascular issues, and many of you have it within your power. You can't change your future. We don't control our destiny in that sense. God is ultimately in control of our lives and our destiny. But what we can do, our decisions affect our future. How many of you know the Bible explicitly tells us and teaches us that we make bad decisions, there's consequences. And us eating bags of Oreos and just being sedentary and not willing to move, all I can tell you is many hours as I work and hours that I put in, and I find the time. And I've had injuries, I've hurt my shoulder, and I've worked around it. And matter of fact, I have one right now, and I ice it, and I use some topical preps, and I use tons of enzymes. And so I tone down my activity. I do other body parts. I work around it. Why? Because I'm convinced of the fact if I'm going to sit here and talk to you about it, that I must be motivated in my heart. And this is not a passing fancy for me. This has probably been about 17, 18 years since the early 90s of committed workout routines, anywhere a minimum of 3 days a week, up to 4 to 5 in some cases. I don't overdo it. Maybe I do. And that's how I've hurt my shoulder. But I try to be reasonable and have reasonable expectations. Let me just read a couple points that I would hope that motivate you. You've got to be diligent. If you're not diligent, you're in trouble. You've got to pray for diligence. Learn from Bible characters. Read Ruth and learn about Ruth's diligence. Respect mentors. We need to understand that if there are other folks that can help you in this area, don't look at them and say, well, yeah, well, he or she exercises a lot and I'm not like them, and they'll look down. No. Respect their mentorship. They can help you. Let them help you. Let them invest in your life. As they invest in you, God will bless them for helping you. Understand good advice and counsel when you hear it and when you see it. Respect that counsel. I'm trying to give you counsel and advice here. I hope I'm not talking at you. I'm trying to encourage you and prod you to make change. This burns in my heart. I'll be quite honest with you. Respect the counsel. Respect the insight. Birds of a feather flock together. Be around productive people. Honestly, don't hang around friends that just want to sit down and watch TV. You need to hang around people that want to make you, take you out and go walk with you and exercise and maybe take you to the gym or help you do this. realize that productive people will help to make you more productive. Make sure that you see it in folks. I like this thought process that comes from Mike Murdoch. Broken focus is the reason that men and women fail. I believe that 100%. When your focus is broken, no matter what area of life, you're open to failure. Make your face like a flint. When you fail, get back up. Let's go tomorrow. You've missed 3 days, doesn't matter. Tomorrow is another day. Great men and women have great habits. Learn from them. You've got to develop good habits. And I don't care if it means getting up 20 minutes earlier and doing this, or doing it at lunchtime and drinking a protein smoothie, then that's what you need to do. Also understand, what you make happen for others, God will make happen for you. If you're willing to invest in someone else's life, and I believe if you let someone invest in your life, what you give away from yourself, I got to believe that God can bring people into your life to help you. We're going to hopefully put together some support teachings in written formats through our website. I want you to stay tuned for the next upcoming video blogs. God bless you. Thanks for being with us today, and I hope that this helps you. Thank you.